Research suggests that 30% of low back pain is actually caused by a retrolisthesis, but many people don't know if they're struggling with it until they have some imaging done, such as an X-ray or MRI. The basics of a retrolisthesis is that it's a backward slippage of the vertebrae, and it can lead to discomfort, pain, and mobility issues. Today, we're going to be covering more of what a retrolisthesis is, what causes it, the symptoms of a retrolisthesis, and what you can do about it. I'm Dr. Amy, PhD manual physical therapist and board certified specialist, and I am empowering women with aging bodies to move like they're 25 again. So what is a retrolisthesis? It's a type of vertebral displacement where the vertebrae is slipping backwards. So your spine is made up of vertebrae. There's 7 in the neck, 12 in the mid-back or the thoracic spine, and 5 in the low back. Most commonly, a retrolisthesis will occur in the low back, causing pain or stiffness with movement. This is different than an anterolisthesis, where the vertebrae has actually slipped forward. Now, there's different types of retrolisthesis, and it's based on how far the vertebrae has slipped backwards. There can be a complete retrolisthesis, where the vertebrae has slipped completely backwards on the one below it. There can be a partial, where it's just slipped a little bit based on the vertebrae below it. And you can actually get a stair-step retrolisthesis. And this is where more than one has shifted, and so your spine creates this stair type. So your spine creates this stair-step type of effect. Now, in a normal spine, the severity of your retrolisthesis can affect your treatment decisions as well as the symptoms you're having. Now, it's important to note here that you do have normal spinal curvatures in a normal spine. And in your low back, you have a curve that goes in or forward towards your belly, or you're supposed to. If you have a retrolisthesis, you may actually have a very straight spine. So, what can cause a retrolisthesis? You can have a degenerative spine disease, and this is most commonly seen in the elderly. It could be due to a spinal injury or a trauma, such as a fall or a car accident. A retrolisthesis can also happen over time due to muscle weakness or ligament laxity. Poor posture, again, over time, can actually lead to a retrolisthesis. And there's certain physical activities that just can lend themselves to this, particularly if you have a job that requires you to be in a very forward bent posture for prolonged periods of time. There are certainly different risk factors that we look at with a retrolisthesis, such as age, activities and lifestyle, and previous injuries. And with that shifting of the vertebrae comes decreased or limited mobility. If the vertebrae shifts further, it can actually put stress on the nerves, which can lead to numbness and tingling in the legs if it's in the low back, or in the arms if it's in the neck. And the muscles then respond as well. You may have muscle spasms or weakness as the muscles are trying to find the correct position for that vertebrae to be in. Now, it's important to note that your symptoms can vary significantly based on the location of the vertebrae that's involved and the severity of the slippage. And this is where it gets really difficult, because many people will come into a doctor's office or a PT clinic and ask, do I have a retrolisthesis? Well, we're going to get to how to diagnose it in just a second, but the important thing here is that every retrolisthesis is different, because it depends on how it's impacting your body, your quality of life, and the movements that you want to be able to do. So, how is a retrolisthesis diagnosed? Well, the gold standard is to have some imaging done, either an X-ray or an MRI, to actually be able to see truly the retrolisthesis. I will say that a good, thorough physical exam will give you an idea if there's a potential retrolisthesis. And many people will ask me in the clinic, how do you know if I have a retrolisthesis or any other spinal abnormality? So you can actually feel it with your fingers. And what happens is when we're going down the spine, we're feeling for where each of the spinous processes are. So spinous process is that part that comes off the vertebrae and points towards your back. or it's supposed to point towards your back. If you have a scoliosis, it's probably pointing in all kinds of different directions. However, it's meant to point straight down your back, and we can feel if one is higher than we expect, which can be a very helpful tool so we know if you're dealing with that in regards to your low back pain. But a true gold standard is going to be to get some imaging, either an X-ray or an MRI. Now, as we're talking about diagnosis, obviously we want to be talking about treatment options. And this is where it's really important to be working with a good manual physical therapist. Because whether or not you have a retrolisthesis, if you have low back pain, you need help in figuring out how to move correctly, how to decrease the pain, and how to get back to the activities that you want to do. Because retrolisthesis is just kind of an ancillary finding in most cases. And that can be a struggle for people to really accept, but most people are struggling with low back pain for a long period of time before they even find out if they have a retrolisthesis. And the truth is, it can't really be changed. Once your body has decided to do that, what we need to do is figure out how to help your body move more normally, even with a retrolisthesis. Yes, I get it. If that's causing pain, obviously we want to decrease the pain. However, changing the retrolisthesis is not going to be what actually does it. We need to change how the muscles, how the joints, how the discs, how the nerves are all interacting with that retrolisthesis to decrease the pain. I have many patients who come into my clinic and may have been diagnosed with a retrolisthesis, and they're wondering how I'm going to help them. Well, the truth is I'm not actually going to change the retrolisthesis. What I'm going to change is how their body is interacting with that retrolisthesis. Because of course, we want to get you out of pain and get you back to normal movement. Movement is life, and every tissue in your body is designed to heal itself as long as it's moving correctly. Now, that doesn't mean that our retrolisthesis will be able to fix itself, but what it does mean is that you can get the other tissues around it moving more normally, which will decrease your pain. Now, are there extreme cases where something like surgery may be indicated for a retrolisthesis? Yes, there may be. And really the thing to look out for here is if you have nerve issues, particularly if you're losing strength or if you're losing bowel and bladder control. When these two things happen, this is a nerve emergency and will require surgery to take pressure off the nerves, which can happen if you have that complete retrolisthesis where it's slipped back off the one below it, and it is actually causing a lot of stress and pressure on those nerves. So if you have lost strength, and not just I've lost strength because I have so much pain, but I've lost strength and I cannot stand up, I cannot walk, I definitely would recommend seeking out help from a medical doctor, because this is a medical emergency and you want to get that taken care of as quickly as possible. However, the research is really, really clear that most people who are struggling with a retrolisthesis really will benefit from more conservative management, including physical therapy and pain management. So if you're concerned that you have a retrolisthesis, maybe you've been diagnosed with a retrolisthesis, or you have low back pain and you're wondering if this is what's causing it, what can you do about it right now? Well, make sure that you are moving regularly and you're doing some core strengthening exercises. You want to make sure that you have as much support through your abdominals as you do through your low back to decrease stress to that low back. You want to make sure that you are maintaining good posture in all positions. It is super important to make sure that that spine is stacked up on top of each other to decrease stress to any abnormal structures, such as a retrolisthesis. And you want to avoid heavy lifting as much as possible if you have a retrolisthesis. But if you have to do heavy lifting, you want to ensure that you do it with the correct posture. You want to make sure that you're bringing that object close to your body and you're really lifting with those legs. If you have a retrolisthesis, we don't want to be putting too much pressure on that low back, especially in that forward bent position. All right, so there it is. If you have been diagnosed with a retrolisthesis or you've been wondering if that's what you have, we've covered today what it is, what symptoms you will have, as well as the gold standard for imaging in order to diagnose it, and things that you can do right now. And if you've watched this video and you've thought, that doesn't really sound like what I have, that's fantastic. However, I do hope you will continue to be vigilant about your spine health, making sure that you're maintaining good posture and decreasing abnormal stress to your spine to make sure that you stay retrolesthesis free.